Hi doctors, come to a special module, approach to medicine, how to do medicine. Okay, so medicine, it is a vast big subject. People will fall in medicine. So there are 20 days remaining for NEET PG from today. Don't fall in the trap of medicine, going to study medicine, revise medicine, taking so much time and unable to study other small subject. This is a trap. Don't fall in that. Okay, medicine is not going to decide your big rank. The small subject is going to decide your rank. So big subjects makes you underconfident. You couldn't complete the subject. You feel like not studied properly. You couldn't do PYQs. It's like incomplete feeling. So in this session, I'm going to discuss the highly important topics in medicine, along with how to approach medicine, how to do medicine in a simple way in the last session. So please watch the session. Okay. Now, in this session, high yield topics of medicine can be discussed soon. Okay, I'll be discussing about the high yield topics of medicine and approach to medicine. Okay, very important. Now you can see the image here. There is a single stone and a multiple stone. This single stone is nothing but medicine. This multiple stone is another small subject. So imagine medicine. In NEET PG 2020, expected questions are 20 to 25. Even though it is a 180 question exam, 20 to 25 question will come from medicine. And study time, you need some 5 to 7 days time. You need revision time. It will take lot of time, and it is a vast subject. For example, if you manage small subject like derma, psychiatry, radio, anesthesia, ENT, ophthalmology, forensic, these 7 subjects together will contribute around 30 questions. So the weightage who are studying this small subject, probability of getting good rank will be high with this small subject, not with the medicine alone. So this is very important. Okay, that's why approach to medicine, how to study medicine, I will be discussing in the end. Okay, clear. Now I am going to discuss the high yield topics in medicine, especially cardiology, nephrology, neurology, GIT separately. We will go individual system and see the important topics. Now mainly first I am discussing about the cardiology. So you can see the major topics here. Cardiology, JVP, I already discussed in my video. These waves, JVPs, regularly they are asking question. Management of hypertension crisis. Hypertension crisis is not that important, but management is very important. They can be a potential question. Murmurs with images. So you imagine pansystolic murmur, they are giving one image, S1, S2 image, murmur ka image. You should know the all murmurs and their images. This can be a potential question. Management of ACS. We know acute coronary syndrome, ACS, and what is STEMI and STEMI. The management, especially the contraindication of thrombolytic therapy, indication of CABG, and the pathological features that this can be asked. So pathology is coming here. Okay, and acute heart failure. So heart failure is divided into wet, dry, different. The drugs are different. That is why pharma is coming here. Acute heart failure management is also very important. ECG spotters. They will ask this only regularly. Heart block, LBB, RBB. So LBB में left bundle branch block में Williams, Marrow. These are important. Heart block type 1, type 2, type 3. LVH, different MI. Inferior wall, lateral wall, anterolateral, this is important. Ventricular tachycardia, polymorphic ventricular tachycardia, pericarditis, hyperkalemia. So these are spotters. Regularly they will ask spotters from here, ECG. You should know that. Even you don't know the concept of ECG, please understand the ECG, see the ECG, understand that what is VT, what is RBB, what is atrial fibrillation. Directly you will get 4 points. No need to by heart or understand the concept. Okay. And atrial flutter and atrial fibrillation, no P waves, and what are the rhythms and everything. Atrial fibrillation and management is important. And PSVT, VT, ventricular tachycardia, paroxysmal suprafacial tachycardia, heart blocks, these are important, their management. And drugs like digoxin. So pharma also will keep a big picture, will impact in medicine here. And you should know cardioversion and defibrillation application. This is also important. Cardiomyopathy and causes and association. For example, we have dilated cardiomyopathy, hypertrophic cardiomyopathy. So for example, some amyloidosis have some association with some cardiomyopathy. You should know that specifically. So these are the some important topics in cardiology. Now I am going to discuss endocrinology. Endocrinology is nothing but pituitary, adrenal, and pancreatic and thyroid disorder. Thyroid is mainly coming in surgery. So it's mainly coming in surgery. Okay, surgery. So pituitary mein we should know SIADH, diabetes insipidus, what are the features, what are the differentiation, and acromegaly growth hormone, what is the management in that, Cushing syndrome, what are the features and investigation, especially the cholesterol, cortisol level estimation and all. Thyroid disorders, this is nothing but mainly our Hashimoto subacute radial thyroiditis, you should know. Grave disease, ocular signs, not nowadays they are not asking ocular signs, but you should know the ocular signs as well. And mixed edema, coma also management is very important. So visual image, video based question are coming, you should know ocular signs as well. Okay. And adrenal, we should know Addison pheochromocytoma, you should know what is GFR, glomerulata, fasciculata and reticularis, and what hormones are synthesized in each. And you should know what is metabolic syndrome features, it is LDL or HDL. So what are the important that you should know, LDL and metabolic syndrome features. And MODY, nothing but maturity onset diabetes of youth, drugs in pharma, drugs in diabetes, pharma, insulins, pharma, management of decay, that's also very important. You should know men's syndrome. Nowadays, these are potential questions. These were INACT type question, now it is coming in NEET also. And in parathyroid, it is purely ortho, parathyroid, bone and calcium related metabolism. You should know Whipple's trial also. So these are the endocrinology major topics I'm discussing in little fast. You should see this and go and plan your strategy. So respiratory system, even though it is easy, it is like simple questions. You should study the important points like obstructive lung disease and restrictive. You should know flow volume curve. You should know FEV1, FEC graphs. Lights criteria, which is important, you should know. Pulmonary thromboembolism, radiology findings. So you should know radiology. So radiology, there are some radiology findings. Even you don't know pulmonary embolism, if you know the radiology finding, you can solve this. And interstitial lung diseases nowadays potential question. So summary table, HRCT findings are very important. And you should know something like occupational lung diseases, pneumoconiosis, and the organic dust related lung diseases. These are important. And the new topics like ABP, allergic bronchopulmonary aspergillosis, and you should know bronchiectasis, COPD, their diagnosis, radiological findings, and clinical features and management. And carcinoma lung, which is a potential, you should know what is small lung cancer, squamous cell cancer, adenocarcinoma, and what are the markers and the specific features of carcinoma lung. This is a potential question, high yield question. So please study carcinoma lung must. And along with, you should know management of asthma, bronchiectasis, you should know cystic diseases of the lung like LAM and PLCH, and CURB65 also you should know. So these are the basics in respiratory system. Now we are coming to discuss about nephrology. Nephrology, you should know basics of cast and renal stone, and you should cover majority nephrology in surgery as well. Okay. And pathology also majority is covered. So patho and surgery covering. Okay, you should know glomerulonephritis, nephrotic syndrome, minimal chain disease, membranonephropathy, PSGN, RPGN, MPGN. This is, you should know how to differentiate from each other. You should know this can be asked. And main thing, you should know CKD changes, the different stages of CKD, acute kidney injury stages and chronic kidney diseases stages, end stage liver renal failure and all, you should know. And tumor lysis syndrome, which asked in 2023 or 2024 NEET, they asked in 2023, I guess. This is also you should know. And tubulopathies like Bartter, Littleman, Gittelman, this can be answered by toppers. So please try to see what is Bartter, Little's and Gittelman's ones. And this is very important in pathology, that is amyloidosis, that can be asked in medicine as well. And IgA nephropathy also, one of the potential question can become. So you should know these diseases, their features, and you should know CKD changes, tumor lysis syndrome, cast and renal stone, and you will be studying in surgery and patho as well. That's why here surgery, patho, which is covering majority of the medicine. Now if you come to the rheumatology, which is a star area, especially you can see the vascularities, large vessel, medium vessel and small vessel, and the Kawasaki disease, especially in pediatrics, you can see in pediatrics, and purpura, which is coming patho also, hematology disorders also. So here, you know, rheumatoid arthritis, osteoarthritis, how to differentiate, management of rheumatoid arthritis, spondyloarthropathy and ankylosing spondylitis. Mainly it is purely ortho. You should know ankylosing spondylitis, X-ray features, early morning stiffness and everything, and is asked regularly. Reactive arthritis, management of gout, that also can be a potential question. Management of gout can come. So you should know purpura, Kawasaki and Behcet's vasculitis. And SLE is now connected to derma, like some derma features, features along with some alopecia. So this also connected to derma and all. Okay, scleroderma, you should know what is Crest syndrome, and Sjogren syndrome, Tricyca syndrome, you should know the features of Sjogren syndrome and management. Okay, this is also very important rheumatology nowadays. You should know the rheumatology part. Okay, and GAT, this is very small, but you should know important, and you are covering majority big topic like IBD, ulcerative colitis, and Crohn's disease, which is in surgery also and patho also. Okay, patho and surgery. So viral hepatitis, which is covering in micro, and hepatitis antigen and antibody, acute and chronic, IgM type or IgG type antibodies, where is acute, chronic, relapse, immune. These are all important with the markers. Okay, hepatitis C drugs are there, Svir, Buvir, and all. This is related to pharma drugs, and their classification are important. You should know MELD score and modified MELD score, and you should know some disorders like metabolic disorder like hemochromatosis and Wilson disease, which is important. You should know serum ascites albumin gradient to differentiate the liver diseases due to portal hypertension or not related. So this is also important part. You should know celiac diseases, especially IgA related. You should know gluten free diet, gluten. You should know bro, barley, rye, oat, wheat. So this is also important question. So GIT is a potential question. And study the neurology in the last, because this is a high topic, big topic, but there is no question may come, multiple question may come, but this is keep it in the last. It's like super specialty level type question. But in neurology or medicine as such, it is a headache. You should not headache and migraine headache classification and management, which is important. Speech disorders and areas like Broca's area, Wernicke's area, what are the aphasias connections, you should know. And Parkinson disease and the management drugs that are related to pharma also important. Dementias, we should know dementias like Alzheimer's and Lewy body dementia, irreversible dementia due to hydrocephalus dementia also potential question that can come, and Alzheimer's also can come. And dermatomyositis, which is more of derma like Gottron papule, V sign, Charles sign, it is like more of derma. And you should know myasthenia gravis, which is in pharma, Lambert-Eaton myasthenia syndrome, and I had done multiple plasma exchange for these cases. Yes, in crisis. And Brown-Séquard syndrome, you should know the diseases, syndromes of this one, you know, lateral medullary syndrome, medial medullary syndrome, Weber syndrome. There are many syndrome in neurology. If you have time, go see the medulla, see the pons, see the nucleuses, make a small note and understand this. This is a big topic. If you want, just go, and at least you should know Brown-Séquard syndrome and ME section of this one, UM and LM lesions. So multiple sclerosis. There, the important thing is our MRI with the dots and fingers will be there, and clinical features and management. And motor neuron system, you should know UM and LM type lesions also very important. You have to know this topic. Okay, management of stroke is very important. You should know hemorrhagic stroke, what are the drug cannot be given, can be given. Management of stroke is very important. So neurology, actually it is a big topic, the medicine is a big topic, but you can see derma can be come in this, and pathology can come. You can see micro will come, pharma will come. See, you can see derma is coming, ortho is coming. Okay, you can see surgery, patho is coming. So nothing but these subjects. See, this is like, so these medicine is like covering from multiple other subjects. So how to approach to medicine? Medicine is it should be like integrated approach. Nowadays, core BTR, cerebellum and doing integrated. But I'll say differently. Start studying patho, micropharma, complete this part. Study biochem, pedia, PSM, community medicine, radio, some ortho, and small derma. This small subject, if you study, it will contribute to medicine. How? Pathomicropharma, if you study this, 40% of the medicine is covered. Pathomicropharma cover almost 40% medicine. If you study biochem, glycogen storage disorder will come. Pediatrics, as we said, the Kawasaki disease and some other thing. Community medicine, some infectious diseases, some vaccine, something related to medicine, some it will come. Radiological analysis, orthopedia, we had seen. So around 20%, total around 60% of medicine is covered here already. Already you are covering 60% of medicine here. Okay, then you do PYT of at least 3 years and revise the PYTs one more time. You will be covering almost 70 to 80% of the medicine. That's why if 20 question come, you can make it 14 to 16 correct also. It's like a topper. So medicine approach is completely different. So you can do like this. Okay. So medicine as a subject, you have the option to skip. If you didn't study medicine, if you do this part, don't skip the PYT series. You can skip the subject, because but you can study these subjects and you can do the skipping option here. So it is like covering the almost subject, and you can study in the last. Definitely study medicine in the last. Don't start in the first. Now only 20 days are remaining. Stay in medicine for 1 week. Definitely you will going from 20,000 to 30,000, 30,000 to 50,000, like your rank is going back. So don't do like that, and study only PYT and revise PYT. Definitely that will also give good mark in medicine. So I am trying to do sessions in cardio, like medicine, especially medicine ka session I'm planning to do. If I have time, I will definitely do like 1 hour may I'll finish cardio, half an hour may I'll finish nephro, like then I am planning to do, but I don't know how I possible. Daily my focus 30 is going with some important topic also, and I will be posting important topics of other subject like community medicine, patho, small subject like derma, psychiatry also I am planning to put video. Please watch this. Please change your approach to medicine. Study the other subject. Come to medicine as an integrated, connected one. And nobody is perfect in medicine. Medicine is a beautiful brand. The art of medicine, understanding concept and applying in patient is very, very beautiful and great thing. We have to respect the medicine as a core subject. But for NEET, we are going to get high score. Not only studying medicine, other subjects also. Give weightage to small subject. Come back to medicine slowly. If you didn't study medicine also, not significant change will come. Okay, this is my personal opinion. If you are feeling different, opposite, please go in your way. But majority, in my experience and in many others' experience, I'm telling. Thank you. Please watch the video. Thank you.